is the front door where you'll come in during COVID. All the staff's going to enter through here, get your temperature taken. Normally you can enter through the staff door, which is right here. So for right now, until further notice, we're going to go in the front door. Once you come in, you're in our lobby, and our patient care coordinator will take your temperature, get your name, walk you through. This is where all the patients can hang out. For right now, we are allowing one parent to be with each patient and wait if they'd like, or they can wait in their car. So once they're here, we would ask them to use the restroom before they come back to pre-op, just to let them know. And then the patient will be brought back into our pre-op room. We have 2 pre-op rooms. This is our first one. And they come in here, they get ready to go back. They'd be pre-op to do all their consents. The parent will still come with them. They're welcome. The parent is welcome to walk them back to the OR. And they would gown up here, put on like their bunny suit, a cap, and then booties if they want other shoes. So from here, we would take you back here. And normally when you guys get here, you would just come down this hallway. This is our second pre-op room. And then here's a restroom if you'd like to change into scrubs, which I'll show you where the scrubs are next. But this is one of our restrooms. This is one of the dental rooms that if the dentists want to come in and consult, they can. So there's a dental room here. This is our red line. So once you go behind this door, you're in the OR. So you would just come down this hallway and turn into the lunchroom, into the lounge. And once you come into the lunchroom, this is where all the scrubs are. And over here we have all the scrubs labeled by sizes. And the top row are the tops and the bottom are all the bottoms. And we also have some scrub jackets here. Help yourselves. All the lockers are pretty much first come, first serve. You can bring a lock if you'd like. Just make sure that you take it home at the end of the day. Otherwise, if you just turn it this way, you can't open it. But usually right now, you guys will probably be the only one here. We have 2 ORs. There might be days that there's double ORs. So keep in mind, this is where you keep your things. This is another staff restroom, and it has more lockers in it. And again, you would leave your scrubs in these scrub bags at the end of the day. So you'll change into our scrubs at the beginning. Make sure you leave them here. We'll get them washed. After that, before you go into the OR, here are the bonnets, and then you'll wear N95 masks. You guys have all been, most of you have been fitted. If you haven't been fitted, just let us know and we'll get you fitted for your mask. You'll keep that mask here and wear the N95 in the OR. So in here we do have breakfast, we have snacks, and then we cater in lunch. So you can help yourself to everything on the fridge. Get here if you want to have breakfast before we get started. We do have our team huddle. Sometimes we have it in here. We have it usually at 6:50 or 6:55, or we'll have it in the PACU, which I'll show you at the end. But we ask that all the dental assistants, all the providers come and join us for that. So we have a good day. All right, so we'll take you into the OR. So you come back here. We have 2 ORs, so this is our second OR, but this is our first OR where you'll be most of the time. And so in here, we have the X-ray system, which is the Nomad. We've got the Nomad where you guys can bring your own computers, so you can download them or you can download them onto our box drive. Dental parts, you guys will be responsible, and there's a list that the nurses will help you, but you'll be responsible for flushing out the lines, changing the traps, and then getting set up with your supplies. So we'll make sure that all your supplies are in the room that you're going to be in when you get started, so you guys can get set up.
So the dental materials, the dental side, we take care of. Anesthesia side, you guys take care of.
Yeah.
Okay.
Yeah. And then we do ask that when switching the room, and there's some new sheets here to help dental assistants. It talks about what you're going to do. You're going to fill the water with distilled water, and it's in this sterilization room. I'll show you. You get x-rays, everything's set up. If you need anything, you ask the nurse that's in this room. And then in between patients, it is different than normal. You're going to help wipe down the room, clean it, and you don't have to do any of the sterilization, but get all your equipment together so the nurse can sterilize it for you. So you do help wipe it down. I can also get you that list if you'd like. That might be easy too. Participate in the timeout. So you'll participate in the timeout, and it's similar to if you've been at Children's. Anesthesia is going to lead it. You just pretty much be respectful, be quiet while they're doing it, and usually the parent is in here, so again, just remember when the parent's here, be respectful. So, and then we'll walk the parent out. So that's the OR. You'll have kind of a wash stand like that with all of your supplies in it. Other than that, let's go check sterilization. So when you're done, the patient will leave, and if you need to help carry the sterilization or carry the equipment to the sterilization room, you would come into the soil. So we've got the clean and the soil. You would bring all of your things in here.
So again, this is soiled, this is clean. So after the case, we're gonna take everything into the soiled.
And then in here, the nurse may ask you to help rinse everything off so we can get it started. But your job is not to sterilize, so just FYI. The way that the patient flows, if you need more equipment, everything is in the clean room, I think. And the nurse will get everything for you, but just FYI, if you ask the nurse is gonna get any of our equipment from you. So we have all of our supplies in here. If in the case of an emergency you need to get out, there is one exit right here. The 2 exits at the front door. There's one more exit back here. And this door takes you outside. So if you ever needed to get out quickly, this would be a way to go. If you had a patient on a bed, you have to go through the PACU. Oh, and now.
I was like, oh crap.
And we're locked. Okay, so, and then, so if you have a patient and you need to escape, your job would be to listen to anesthesia and to the provider as to what you would do. Because if you are transferring a patient, you would all have to go out this way because of the bed size. So this is the PACU, so now you're behind the red line. We have another restroom. We have our storage room with all of our linens, and then now you're in the PACU. So patient would be here, the parent would be called back once the patient's ready to see their parents, and they'd sit here, and once they're ready to be discharged, they would go out that door, and that exit is an exterior door.
And then when you guys call the parent back, they're gonna come around here to pick them up.
Yes.
So the parent's gonna come through this door and pick up the patient, or come with the be with the patient until they're ready to go, and then they'll exit back out through that door.
Yeah, so they'll move their cars around, end of day. Once they're done, they'll move back. So.
And for the doctor to do pre-op consultations, will be in the exam room, or the pre-op exam room. After the procedure, can we use the consultation room?
Yeah.
Or if they're the only ones in the entry, we can talk to them there.
Yeah, but you can also ask them to come back, because we could also grab the parent and bring them back too.
Okay.
When there's double OR days, we can definitely, that's what the consult room is for. Yeah. So, and then that's kind of the whole thing. And so then if you went back to the front, you could, if you didn't walk through here, if you walk through these doors, you would be back at the front. Now I do need to show you one more thing. That's the front, but hold on. There is, if you need a smoke fire extinguisher, there is one here in the PACU, and there's one in the OR hallway. So we've got those 2. Other than that, I think that's kind of the basis. Anything else? Okay.